colleges, we have all 19 branches of MD, MS. Not only this, we have DM and super specialty doctors also. Got my point? How many of you got it? So that is the tertiary level, right? The tertiary level, the last referral. So you tell me, what is the first point of contact? The first point of contact with the patient is primary, the primary contact. That is PHC and sub-center. This is the first referral. This is the second referral. So this is how you have to learn. This is the system. So levels of primary health care. So government has decided that we will provide a care to our people. The government of India, along with many other countries, with WHO, they have decided that we will provide primary health care to all the Indians, to all the people who reside in India. Such a care which is very affordable, such a care which is accessible, which is available, which is very cheap, which is scientifically proven, and such a care we are going to provide to everyone. How? What is the infrastructure? How you will provide? So we have three levels. We have created a three-tier system. The first tier is primary level. At the primary level, this is the first level of contact between the people and the healthcare system. So it is primary health center, PHC, sub-center, and village health unit. Village health unit is also there. So village health unit, sub-center, and PHC will come here. The secondary level of care is just the first referral. If patients are not treated here, they are referred. Referred where? At CHC and district hospital. So CHC and district hospital will come here. This is first referral. If they are treated here, it's good. If they are not treated, they are further referred to tertiary level. This is the second or the highest referral. It is medical colleges and hospital where not only MD, MS, the super specialty is also available. The super specialty is also available. Okay? Got it? Got it? Can we go ahead? So this is the three-tier system. Primary healthcare, secondary healthcare, tertiary healthcare. Primary healthcare include village health unit, sub-center, and PHC. Secondary healthcare includes CHC and district hospital. And tertiary healthcare finally included teaching hospitals, the medical colleges. Okay, so we will see their details one by one. Let's start with sub-center. First, I will teach you sub-center, then primary healthcare, then secondary community health center, that is CHC. So at sub-center, there are two types of sub-centers, sub-center A, sub-center B. In sub-center A, three staff is there. In sub-center B, 4 staff. Sub-center don't have any doctor. Sub-center don't have any doctor. In sub-center, basic care is given. Very basic, like ORS is available, basic things are available. Very basic care. Here only there is one female worker. One female worker, one male worker, and one part-time Safai Karmchari. Only 3 people are there. There is no doctor. Okay. At sub-center B, there are 2 females. Instead of one female worker, 2 female health workers are there. Male is still 1 and Safai Karmchari is there. So total 4 are there. Because at sub-center A, only services are there but deliveries are not done. At sub-center B, along with the services, there is also a facility of the delivery. There is also a facility of the delivery. Vagina delivery, not cesarean section. So coming on primary health center. Sub-center is done. Primary health center are also of 2 types. Type A, type B. What is type A? So at primary health center, deliveries are done. Less than 20 deliveries in a month is type A. More than 20 deliveries in a month, that is type B. So type A, type B. You can see the staff. Kaun hota hai? Primary health center pe kaun hota hai? So there is a medical officer who is MBBS, who is the head of the team, who is the head of everyone who is there at PHC. The doctor, the MBBS doctor. It's not MD, it's not MS. It's simple bachelor degree. Ayush is proposed. You may be knowing this news now. The government is proposing Ayush at the village, but there is much protest in that. Many people are protesting. Ayush, you know, na? Ayurved, Unani, I told you, yoga, Siddha, and homeopath. So these doctors can also go and remain in the PHC, and they can look in the patients, because the MBBS doctors are not willing to go in the villages and give their services. Now that's why government is proposing to send the Ayush doctors there. You know this news, but it is proposed. It's not confirmed yet. Apart from that, there is a data entry operator, with a system. He will be having a computer in which he will do the, I don't know whether the computer will be there or he will be doing the manual entries in the notebook. So there is a data entry operator. There is a pharmacist, one pharmacist. There is a nurse midwife, staff nurse, 3 staff nurse. There is a female worker, 1, male assistant, 1, health assistant female, that is 1. Okay, lab technician, 1. Okay, multi-skill group D worker. Group D worker, you know what a group D worker, the ward boys and all. So there are 2 ward boys and all. Sanitary worker and the watchman. The same person is a sanitary worker and the watchman. That is one. Total 13. Total 13. And we have proposed at many places. Hana? So we want 18, but currently it's 13. So 13, and here we have 14. Here we have 14. That's it. Hana? So 13 and 14. That's it. We can see in type 1, type 2. This is the first point of contact between the people and the healthcare service. Okay, got it. Can we go ahead? The medical officer is the leader of the PHC. In PHC, there are 4 to 6 beds. How many beds are there? 4 to 6 beds are there. The next is the CHC. CHC. This is the staff written in front of you. So there is a medical officer. There is a medical superintendent. There is a public health specialist. There is one physician who is MD. There is one surgeon who is MS. There is one obstetrician who is MS. है ना? There is one pediatrician who is MD. अब सर्जन है तो सर्जन बिना एनेस्थीसिया के तो सर्जरी नहीं करेगा. So there is anesthetologist, है ना? There is one anesthetologist. Okay, that is MD. One dentist is also there, है ना? BDS doctor. One BDS doctor. 2 general duty medical officer, the MBBS doctor. 1 Ayush doctor. 1 ophthalmologist who is having MS in ophthalmology. 1 nurse and 10 other staff nurses, है ना? And that's it. So this is the complete staff of CSC. Don't learn for your knowledge, I'm telling you. Okay, got my point? है ना? Under one CHC, four PHCs come. Under one PHC, 6 सब सेंटर come. So सबसे पहले है सब सेंटर, है ना? 6 सब सेंटर के ऊपर एक PHC है. 1 PHC over 6 सब सेंटर. और 4 PHC के ऊपर एक CHC है. 1 CHC over 4 PHC. How many of you got it? So you have to learn all this. Okay, got it? Say yes or no. These are the population norms you have to learn. You have to learn. There is no choice. You have to learn. Listen, subcenter, PHC, CHC. We are done with all 3. Compare it. Compare it. We have seen subcenter 2 type AB. We have seen PHC 2 type AB. But CHC don't have any further type. So can I say subcenter and PHC is the primary level of the care, and CHC is the secondary level of care? I told you, है ना? The PHC, this is in plains and this is in hilly area. In plains, we require every 5,000 population, there should be a 1 subcenter. But in hilly area, we require every 3,000 of the population, there should be 1 subcenter. Because in hilly areas or tribal areas, we want at more frequency. Got it? So normally in plains, we want 1 subcenter every 5,000 of population. But in hilly or tribal area, every 3,000. Now what I taught you, into 6 into 6. I taught you 6 subcenter 1 PHC के अंदर आते हैं. Have I taught you this or not? 6 subcenter 1 PHC के अंदर आते हैं. So 5 into 6 is I guess 30,000, है ना? So over 30,000 or 6 into 3 वैसे तो 18 होता है, but make it 20. So 30,000 and 20,000. In the plains it's 30,000. In hilly area it's 20,000. Say yes. Got it? Got it? And make it 4. है ना? Into 4 times. I told you 1 CHC में 4 PHCs आते हैं. So 3 into 4, 1,20,000. 20 into 4, it will be 80,000. So how many of you learned it? You get many questions on that. What is the staff? At subcenter, we have 3 staff. 1 male worker, 1 female worker, 1 safai karmi. है ना? Or 4 staff in type B. Here we have 13. And here we have 46. Please learn it. Subcenter is under central government. But PHC and CHC are under state government. How many of you got it? Respond, people, respond. Very important. So I taught you 3 things here. What 3 things I taught you? I taught you subcenter. I taught you PHC. I taught you CHC. Okay, G. Subcenter, PHC, and CHC. I taught you. I know. You tell me the level of the care. So you will say, ma'am, this is primary, this is primary, this is secondary. Okay, you tell me the number over how many population norms. So tell me the population norms in plains and tell me the population norms in tribal or hilly area. You get definitely question from this. Very important. In the plains, it's 5,000 and 3,000. Here I will say 30,000 into 6 कर दिया मैंने यहाँ, and 30,000 and 20,000. है ना? और यहाँ पे into 4 कर दूंगी मैं. So 1,20,000 and it will be 80,000. Let me write. Here I do into 6 into 6 into 4 into 4 because 1 PHC over 4 subcenter and 1 PHC over 6 subcenter and 1 CHC over 4 subcenter. How many of you got it? Please learn it. If you got it, it's good. If you didn't got, learn it. Please learn it. Please. I request you to learn these figures. I request you to learn these figures. You definitely get questions from them. And tell me the staff. Here total 3 staff are there. Here 13 is there. Here 42 is there on an average. This is under central government. This is under state government. This is under state government. This is the summary. This is the gist. Please learn the 3-tier system I'm talking about. Okay. Got it? Now, job responsibility of a male worker and the job responsibility of a female worker. I'm not reading it, but you just read it for your own. है ना? Female क्या करेगी? Female will maintain the register of pregnancy. Female will take care of the family planning unit. Maintain the eligible. I told you yesterday who is the eligible couple. The wife is in reproductive age. Eligible couple register maintain करेगी, है ना? MTP के records को maintain करेगी. Nutrition का ध्यान रखेगी, है ना? Iron folic acid tablets will be given, distributed. Immunization, TT in the pregnancy, है ना? दाई की ट्रेनिंग करेगी. She will train the दाई. You will train her and she will train दाईs, है ना? दाईs for the home delivery. Communicable diseases को notify करेगी. Vital events का record maintain करेगी. The birth and the death, है ना? Record keeping का काम है. Treatment of minor diseases like diarrhea वायरिया में ORS यही दे देगी, आपकी जरूरत नहीं है. And team को टीम की एक्टिविटीज का ध्यान रखेगी. So she is female. Male worker को सब घूमने वाले दो. Record तो ये भी maintain करेगा. There are some activities which are common. लेकिन मलेरिया की स्लाइड घर घर जाके कलेक्ट करना वो फीमेल नहीं करेगी. The male will go house to house and collect the slides for the malaria, है ना? So this will be done by the male. Okay. So like, and the same, identify and suspect leprosy, TB cases, sputum collection, chlorination of the water. अब well कहाँ पे है? Village में well होगा ना, तो well पे जाके उसमें chlorination करना ये female नहीं करेगी, male worker करेगा. So there are some responsibilities of the female, some of the male, and you are the head of both. So you will assign their responsibilities. You have to do this, you have to do this, and you have to keep a check on them. You have to keep a check on them that whether they are doing their responsibilities regularly or not regularly. Got it? This is the thing. So that's all about it. That's all. Read the question, tell me the answer. One PHC is located over how many population? How much population? I'm mentioning nothing. So I'm asking for planes. If I mentioned nothing, I'm asking for planes. Can you please tell me? What is the correct answer? What is the correct answer, people? Yes, PHC I'm asking now. Answer is 30,000. And if I include in the hilly area, then answer will become 20,000. Then in that case, answer will become 20,000. If instead of PHC, if I say subcenter, answer will become 5,000. Likewise, we change the question, the answer changes. Read the question. A subcenter in hilly area. Please read it very carefully. A subcenter in hilly area over how much population? Every 1,000, every 2,000, every 3,000, or every 5,000? What's the correct answer? A subcenter in a hilly area. It's over 3,000. And if I remove the hilly area and do it in plains, the same question will become 5,000. So 3,000 and 5,000. Learn the two figures for subcenter. Learn the two figures. Which of the following is not a work of female worker, female healthcare worker, not a work of the female worker? Malaria surveillance, distribution of condoms, immunization, or DOTS activity? What's the correct answer? Yes, malaria surveillance is a work of the male worker, house to house slide collection for malaria. It is for male, not for the female. Rest of them can be done by female also. Contraception, she takes care of that. Okay, can we go ahead? The next question. CHC, Community Health Center, over how much population? If I'm mentioning nothing, I want to ask you in planes. Or both, there is a range. 40 to 60,000, 60 to 80,000, 80,000 to 1,20,000 or none. So it's 80,000 to 1,20,000. Basically, 80,000 is in hilly area and 1,20,000 is in plains. So both are given. The range is given to you, minimum and maximum. So you definitely get questions on that. We are done. We are done with this chapter also. Congratulations. Okay, you have to learn this list. You have to learn the first country to start the initiative. Do you know the first country to start family planning is India? The first country to start blindness program is India. The first country to launch ORS, low reduced osmolarity ORS. I told you na 245. Total is 245. I told you glucose is 75, sodium is 75, chloride is 65. Total was 245. It's new ORS, the reduced osmolarity ORS. It is also launched by India. The term pasteurization and germ theory, these were first launched in the France. Socialized medicine in Russia, and compulsory insurance, health insurance, it's in Germany. So learn, you get questions on them, especially in India. Please learn. India is the first country to start three things. start family planning services, start blindness control program, and launch ORS. India is the first country. Okay, got it? India is the first country. Okay, these are the important days you have to learn in the end. I'm giving you, I'm not from January till December, the complete list is with you. In January, only one date is important, 30th January, Leprosy Day. In February, only one is important, 4th February, it's Cancer Day. है ना? On March, many 4 dates are there which are important March में. So March में 6th March is Glaucoma Day, 8th March is Women Day. None of you celebrate that, I know. So 20th March is Oral Health Day, and 22nd March is Water Day. So this is how you have to learn. 7th April is Health Day, on which every year WHO give the theme, the new theme of that year. And 31st May is No Tobacco Day. Likewise, you have to learn the days. Please learn. 21st June is Yoga Day. 1st July is Doctor's Day. I guess everyone knows the 1st July, Doctor's Day. 11th July is Population Day. So please learn. Jitne bold mein hai na, question is already there on them. So breastfeeding week, I already taught you when I taught you breastfeeding. 1st to 7th August. Literacy Day, I already taught you when I taught you literacy rate in demography, 8th September. IDD, iodine deficiency disorder, it's 21st October. Immunization day is on 10th November. Diabetes on 14th November. Polio day is on 24th October. Please learn it. AIDS is on 1st December. AIDS day is on 1st December. Got it? How many of you got it? Can we go ahead? So please learn it. We are done with this also. Okay, so let's come finally now. Annotated PDF. Few students were asking, so I will share the annotated PDF today. All the annotated PDF. Maybe all 16, 17 chapters, whatever I am teaching you. I will share annotated PDF today evening to you. I will share with the team, and they will share with you. Okay, ji, I have saved them. Okay, the last chapter now. Finally, the last chapter, National Health Programs. Can we start National Health Programs now? Let's start National Health Programs, the last chapter. Maybe 1 hour or 1.5 hours. We will pack after that. If still after that you have any doubt, you think some topic is important and like that, then you can let me know. I will take it, Simran, I will take it. You want me to take the committees? I will take the committees first. I forgot to take. Thanks for reminding. Okay, let me come on the committees. Okay, these are the health committees. Just take the important point in them. So let me read the name of the committees, then I will tell you the important points in each of them. Bhor Committee, Mudliar Committee, Chaddha Committee, Mukherjee Committee, Junjunwala Committee, Kartar Singh, Srivastav Committee, Krishnan Committee, Bajaj Committee, Tendulkar Committee. They come in this sequence only. The first is the Bhor Committee. It lasts from 1946 onwards. 1946. After that, Mudliar came. After that, Chaddha came. Mudliar सिर्फ 1 साल के लिए आया, 1962. उसके बाद Chaddha take over. Chaddha is 1963. After that, 1967. Then these are the health committees. One by one, a committee. The government is making a committee that takes care of the health of the country people. These are the name of the country. Communities given. One by one, they are launched. 1967, Junjunwala. 1973, Kartar Singh. Then Srivastava. Don't learn the year. Learn them in a sequence. Okay? Okay. So, coming on the committees. The first committee I taught you is the Bhor Committee. Bhor Committee, also known as Health Survey and Developmental Committee. Don't learn the other name. इसने 2 चीजें बोली. एक short term measure, एक long term measure. The first time Bhor Committee said that we should create a PHC every 40,000 population. But nowadays it is 30,000. We know. 30 and 20. First time they said we should have one PHC over 40,000 population. That is the short term goal. And with 2 medical officers. Okay, that is a short-term goal. It should be 30 bedded, but we now the PHCs are only 4 to 6 bed, and there should be 3 sub-centers under 1 PHC. But now there are 4 sub-centers. Everything is changed now. It was the first committee, जिसने first time हमको ये सब guidelines दिया. Right? The long term is the 3 million plan. What is the 3 million plan? There should be a primary health unit with 75 bedded hospital. एक 75 bedded hospital बनाना है. Okay, that is known as primary health unit. The secondary health unit banana hai, which should be a 650 bedded hospital. एक regional health unit banana hai, which should be a 250 bedded hospital. So that is 3 million plan. These were the proposition. Don't learn it. Just see कि what you have to learn, the Bhor committee have given 2 recommendations. What were the recommendation given by the Bhor committee? We should make a PHC over 40,000 of population and the 3 million plan. In 3 million plan, there should be a primary health unit, secondary health unit, and regional health units are there. These are the bedded hospital. He has created social physicist. उसने promote किया कि in MBBS education there should be 3-month posting in PSM. You have your postings in PSM. Do you have internship? You may have postings now. So you have in your entire curriculum, you may have 3-month training in PSM department. Then you are known as social physicist. If your 3-month training is over, now you, along with the doctor, you are social physician also. Social physician. He introduced this term. He has introduced the school health also. In the school, I told you, every 6 months, the free checkup of the eyes is done, the dental checkup is done. So that is school health. In the school health, free services is provided in the school people, the school children, I mean. So this concept is also given back. So 4 concepts he has given. So just learn the green I have highlighted. Bhor committee. क्या दिया Bhor committee ने? Number 1, PHC का concept. Number 2, 3 million plan. Number 3, social physician. And number 4, school health. How many of you got it? Please learn that, है ना? Learn it. You don't have to understand much. Just learn कि ये सब इसके recommendation है. उसके बाद next committee आई Mudliar committee. Mudliar committee, उसने कहा 1 PHC per 40,000 population maximum, and he constituted All India Health Service. All India Health Service का constitution इसने किया. That's it. Not much contribution because it is only for 1 year. After that, it is replaced by the next committee, Chaddha committee. This committee was dismissed and a new committee is formed by the government, the health committee. That is Chaddha. है ना? चड्ढा ने बहुत गड़बड़ किया. क्या गड़बड़ किया? है ना? We have two problems at that time. In 1963, we were facing 2 problems in India. Number 1, malaria. Malaria was a real, very big problem in India at that time. And number 2, family planning. Number 2 was the family planning. है ना? Family planning means contraception use has to be increased. So we have to aware more and more population, the eligible couples for the contraception use. So we were having different stuff. So we were having different staff working for that. But he has linked the 2. He has said there should be only 1. उसने cost cutting किया. उसने बोला एक ही basic health worker रख लो PHC पे. एक ही basic health worker रख लो every 10,000 of the population, जो malaria vigilance भी करेगा और family planning का भी काम करेगा. है ना? So उसने गड़बड़ कर दिया, है ना? अब एक ही बंदा है. There is only 1 person who is taking care of both the programs. So family planning program is separate thing. Malaria control program is separate thing. Both are conducted at PSC. So there is only 1 worker, the basic healthcare worker who is taking care of the 2 things. So he has linked the 2 programs together. Which 2 program? Malaria and family planning. At the end result क्या हुआ? ना तो ये अच्छे से हुआ, ना तो ये. है ना? So neither we fulfilled the goals and targets here, neither we fulfilled the goals and targets here because we are having only 1 basic health worker. So that is the Chaddha. That was a flop show. That was a real flop show. Okay. So next committee is Mukherjee. Mukherjee has done the D-link. What does the Mukherjee has done? D-link. D-link कर दिया वापस उसको. Malaria अलग, family planning अलग, different stuff. है ना? So they have again D-linked. And separate staff for the family planning. Separate staff for malaria, separate staff for family planning. इन्होंने समझदारी की बात की. How many of you understand Hindi? हाँ, got it? So चड्ढा ने जो गड़बड़ किया उसको मुखर्जी ने सुधार दिया. है ना? Learn. शुरू से learn करो. भोर ने क्या किया? First, he introduced PHC over 40,000 population. He has given 3 million plan. He has created social physician. Any MBBS doctor who is doing 3-month compulsory posting is known as social physician. Okay, and school health introduced kiya usne, the concept of school health. Mudliar have constituted All India Health Service. That's it. Chaddha have linked the 2 things together, and Mukherjee have de-linked them. Mukherjee ne de-link kar diya. The 2 things are malaria and family planning. Are you people there? Reply, respond. The next is Jhunjhunwala. The next is Jhunjhunwala. इन्होंने क्या किया? इन्होंने बहुत अच्छी बातें की, है ना? I like their work. So what they have done? They have done unified cadre, common seniority, recognition of the extra qualification. If someone is extra qualified, we should recognize it. Equal pay for equal work, special pay for special work, and no private practice. They recommend कि India में private practice करना ही नहीं चाहिए doctors को. Doctors should not do private practice in India. Everyone should be in government practice only. Government hospitals should be very good. Equal work for equal pay, special work for special pay, and extra qualification recognition, common seniority, and good service. So all the things are very good. है ना? Ideally, it should be followed, but it is not followed. है ना? So we have many things working here, है ना? So not equal work for equal pay, not special work for a special pay. Even extra qualification is there, so they don't pay extra. They say you are all overqualified for the work. We don't require you, like that. So working environment for the doctors should be good, like that. So that is the Jhunjhunwala ke recommendations. After that आया Kartar Singh committee, है ना? So what he has done, Kartar Singh ने all the ANMs को replaced कर दिया female health worker से. Female health worker, the female health worker. Now there is only one female health worker, not multiple ANMs. Okay, all the malaria worker, vaccination worker, health education assistant, family planning worker, they all are replaced by male health worker. So at PHC we have one female worker, one male worker. Hana? The female worker, actually she was ANM, it is replaced by female worker. And male worker is, it can be malaria worker, vaccination worker, health education assistant worker and family planning worker. उन सबको combine करके एक male worker बनाया. Kartar Singh recommended one PHC over 50,000 of the population, है ना? Over 15 to 16 sub center, जो सब change हो गया है आज, है ना? And there should be a supervisor. This is male worker, female worker. They both have supervisor, male supervisor and female. So under one supervisor, there should be 3 to 4 workers. Under one female, 3 to 4 workers. है ना? The workers, the male health worker and female health worker, they are juniors. Over them, they have their supervisors. So male health supervisor, female health supervisor. Under each supervisor, there are 4 male worker, there are 4 female worker. है ना? Basically, male worker is a replacement of all the malaria worker, vaccination worker, education, family planning. They all are replaced by this. And all the ANMs are replaced by this. How many of you got it? How many of you? So this is Kartar Singh. Kartar Singh, one multi-purpose worker. It is known as one multi-purpose worker, the male, the female. Job responsibilities are different. So till date, we are following it. So that is Kartar Singh recommendation. The next is the Srivastav. Srivastav ne kya kiya? Srivastav have created bands of para-professional and semi-professional health workers within the committee. Okay. He has done the reorientation of medical education. Reorientation of medical education scheme, ROME. Nowadays, we are going from NEET PG towards next. Na? So what basically we are doing? Next aane wala hai, everyone knows, है ना? We are doing the reorientation of complete medical education. We are reorienting it, है ना? So Srivastav ने जो तब recommend किया था, we are going to follow it. I don't know when, maybe in 2028 they are saying. So anyways, that is the reorientation of medical education. He proposed, है ना? And village health guide को first time इसने introduce किया, the scheme of village health guide. So please learn main contribution. Krishnan ने urban revamping किया, और Bajaj is not important. You can leave Bajaj. So we are done. We are done. So please learn the main contribution of the committees. These are the health committees the government appoints for 5 years. Before 5 years only, many of them get dismissed and new committee is formed. Say yes, people. Say yes. Read the question. Tell me the answer. You people are alive? I mean, you are live. Read the question. Tell me the answer. 3 million plan was proposed by. Very commonly asked question. Is it Kartar Singh? Is it Mudliar? Is it Srivastav? Is it Bhor? Who has given the 3 million plan? Who has given the 3 million plan? Very important, 3 million plan. Don't learn the 3 million plan. He has said 3 types of hospitals to be created: the primary, the secondary, and the village hospitals. This is 750 bedded. This is something 650 bedded. I don't remember. This is 250 bedded. Don't learn how many bedded. It's a 3 million plan. That's it. Bhor committee. You all are right. Very good. Multi-purpose worker scheme in India was recommended by the best scheme. All females are replaced by female health worker. All males are replaced by male health worker, and they should have supervisors. So is it Srivastav, Bhor, Kartar Singh, or Mudliar? Who was an intelligent person? Which committee? Yes, Kartar Singh. Kartar Singh. He was very intelligent person, and I like his recommendation. Till date, it is followed. The multi-purpose worker. One female worker, one male worker. Okay. So correct answer is Kartar Singh. Okay. Integration of the health services was first proposed by. Integration of the health services. I forgot to tell you, it is Jhunjhunwala. Just the integration of the health services kiya. Multiple health services were integrated together. Concept of multi-purpose worker, I already told you, it's Kartar Singh. So I'm skipping, it's a repeat question. You get malaria and family planning linking and delinking also you have to learn. So Chadha has done the linking, and who has done the delinking? Chadha has done the linking, and Mukherjee has done the delinking. These two are also PYQs. So that's all about it. Got it? Who was asking? So this initial portion is also done. Okay, so these committees, you usually get questions on that. Not very important topic, but yeah, still, we have covered it. So can we start the national health programs now with your due permission? Can we start? Let's start it. Okay. Okay, so let's start national health programs. The important one only we will take here. So let's start first the maternal and child health care programs. Then we will come on adolescent program. First, we will see the maternal and child health care. Have you heard about RCH services, reproductive and maternal neonatal child health care services? It is known as RNCHA, RMNCHA. What is RMNCHA? Say R is reproductive services. We will provide reproductive services. है ना? M is maternal service. What is reproductive service? We will provide contraceptive to the couples. What is M? Maternal service. We will provide services, the antenatal care to the mother, the pregnant lady, I mean. N is neonatal. After the birth, we will take care of the neonate also. है ना? C is child. है ना? The neonate will convert into child while growing. है ना? And A is adolescence. So we are providing services to 5 people together. है ना? So it is the health service which I am providing to 5 people. A बाद में ऐड हुआ है, पहले सिर्फ RMNC था, है ना, but बाद में A भी ऐड हुआ, so it is after health. So we take care of health of five group: reproductive age group, maternal, neonatal, child, and adolescent. So this is RMNCHA. H is the health of whom? Health of reproductive age group, है ना, they will reproduce. The mother will become pregnant. I mean, the lady will become pregnant. That is maternal health. Then she will give birth to a child. That is neonate. The child will grow, and from neonate, it will convert into child. And later on, the child will convert into adolescence. And adolescents again reproduce. So it's a cycle. You can understand like that. I learned like that. So you can say RMNCHA. Say yes. So this is the services we provide. So it is having 5 into 5 matrix. What is 5 into 5 matrix? We are having 5 group. I told you what 5 group. Reproductive age group, what services we are providing. So we are providing 5 service to each of the group. Reproductive age group people, we are providing 5 services to them. Pregnant ladies, we are providing 5 services to them. Newborn, we are providing 5 services to them also. Children, again 5 services. Adolescents, teenage, we are providing 5. It is known as 5 into 5. I don't recommend you to learn all 5 into 5, but have a look. This is 5 into 5 matrix. So they give you a question, 5 into 5 matrix is seen, and you have to mark RMNCHA. This is 5 into 5 matrix. You got it? What are 5? 5 groups are in front of you, and 5 services to each of them. Say something now. So reproductive age group, what services we provide to reproductive age group? We provide contraceptive devices to them. है ना? Intrauterine contraceptive, postpartum contraceptive devices to them. है ना? IUCD we provide, number 1. Interval IUCD also we provide. है ना? Just after the delivery we can insert IUCD, and after some time interval IUCD also we can insert free of cost. Home delivery of contraceptive. Asha will go door to door and provide condom and OCPs. For IUCD, they have to come and get inserted. It is not a home procedure. But OCPs, condoms can be given. Home delivery of the contraceptive we are doing. Asha is acting like Swiggy, and she is giving it there. Hana? Home door to door. All the eligible couple register is there. Hana? So wherever there is an eligible couple, she can provide. Okay. Nishchay kits, the pregnancy kit. I have shown you the image yesterday. Now, Nishchay kit, the pregnancy. If any lady is doubtful whether she is pregnant or not, free pregnancy kit, urine pregnancy kit, UPT, is provided to her. And 5th, quality sterilization. Hana? If lady want to be permanently sterilized, not only lady, male or female, vasectomy, tubectomy, both services are provided. So these surgeries are free of cost. So these are the 5 services we provide to reproductive age group, the males and females, free of cost. To the mothers, the pregnant ladies, we provide maternal child tracking system, MCTS. You know what is MCTS? As soon as a delivery takes place, na, in the mobile there is an app. It is known as MCTS app. Hai na? It is an app in which we do the entry of the mother, the mobile number of the mother, and all the details of the mother we fill, and the newborn also, all the details we will fill. Hai na? So time to time there will be a SMS, free SMS or free calling services there. They will get the SMS whenever there is a time of vaccination. So it's a time for your baby to get vaccinated. है ना? This vaccine is pending. Or Hindi mein they will get the messages like that. है ना? So they will come to know. We can track them. If they are not coming for the vaccination properly, there is an address, someone can visit, we can call and we can trace them. So it is a tracking system, the mother and child combo tracking system. It's like an app, and everything is software. So we can do so. Okay. High risk pregnancy, we will give special care, special tracking. Emergency obstetric care we provide. Okay. Maternal death review. None of the mother in India should die. Mother means pregnant lady. if any mother, any pregnant lady dying during pregnancy at the time of delivery or within 42 days after the delivery as a complication of delivery, it should be reviewed. It should be proper review. It should be reasoned. A committee sits and they discuss you why this happened so that it doesn't happen again. Whose mistake was there? Why it happened? So there is a committee and it should be answerable. It should be answerable that why the death occurred, what was the reason of the death, and at what step we can avoid it so that from next time it shouldn't happen. And misoprostol, the emergency contraceptive after sexual intercourse, if someone wants the contraception, the emergency contraception. So these are the five. No, misoprostol is for abortion. If some lady wants the MTP, abortion, so misoprostol is for that. So these are the 5 free services to the mother. What are the 5 services to the newborn we provide? We provide the breastfeeding. The breastfeeding, I told you, the protocol, the 10 baby breastfeeding friendly initiative we have taken. So breastfeeding, home-based postnatal care, essential newborn care. There is ICU, sick newborn ICUs are there, and gentamicin is provided by the ANM if the child is sick, having diarrhea or having respiratory tract infection. So these are the newborn services. The child services, we take care of the nutrition, diarrhea management, pneumonia management, immunization, Rashtriya Bal Suraksha Karyakram. I will tell you what is it. And to the adolescent teenage pregnancy, we give them sex education, teenage pregnancy, it should be avoided, it should not be done, like that. And community-based services, adolescent reproductive sexual health, clinics are there, weekly iron folic acid supplementation, menstrual hygiene. So all these information is given them. This is 5 into 5 matrix. I do not want you to learn it, but you have understood it's good. So you know the 5 groups and 5 into 5 matrix. Okay, so let's start with the maternal programs now. In the maternal programs, the first program I would like to tell you is the Janani Suraksha Yojana. Very, very important. I forgot to put the logo. Janani Suraksha Yojana. What is Janani? If you know Hindi, Janani is mother. Suraksha, protection. Yojana is a scheme. So it's a scheme in which we give protection to the pregnant ladies, the mothers. They are going to be mothers, the pregnant ladies. Now, how we want to protect the pregnant ladies? We do not want any of the pregnant ladies should die, either during pregnancy or during delivery or after delivery within 42 days. We do not want they should die. We do not want. We want to protect them. The government want to protect them. So we want institutional delivery. What do we want? We want institutional delivery. So maximum deliveries should take into the institutes only. But in India, especially in villages, home deliveries are very common. The senior female of the family, like the grandmothers and all, they just conduct the delivery. They know कि हमने तो 10 बच्चे पैदा किए. I know how to do it. Don't get admit in the hospital. It will be very costly. We cannot afford it. We will do home delivery. It's vaginal delivery. It will be automatically done. I mean, we will assist it. So the senior female only conduct it, and multiple senior females of the village, they just gather together and they just conduct the delivery. We do not want that. If it is a normal vaginal delivery, it's okay. But if it is some complication takes place at the time of the delivery, what they will do at that time? They are not prepared for that. So all the deliveries should be institutional. We want to do that. So how to do that? We are counseling them, come in the hospital, do delivery, it will be free of cost, come. They are not coming. It's very difficult. It's very difficult to change someone's mentality. Opinion can be changed. Behavior can also be changed. But actually, it is converted into action is very difficult. The last step is very difficult. You can change someone's opinion by giving a good speech, by telling them the facts. You can change someone's behavior also. But converting into action, what you are saying, they should convert into action. The last step, they are convinced. They will agree with you. Yes, you are right. You are right. But they will not do that. It requires a very high degree of motivation, especially in the village people where they are not very educated. So it's very difficult with them. You got my point? So what we have done, see what government has done. Government has launched Asha, and we asked Asha, we will give you a fixed salary. Your fixed salary is fixed, whatever we will give you, that is the fixed salary. Along with that, we will give you incentives. Incentives are extra payment. Along with the fixed salary, you will get extra payment for what? Based on what? How much? How many? Now, Asha is for one village. For one village, there is one Asha. So in your village, how many females get pregnant? Whosoever female get pregnant in your village, in Asha's village, she, during the 9 months of pregnancy, she has to counsel that lady, go and counsel in the local language that you have to do institutional delivery. If we will go, we cannot counsel the village people very good. Sometimes we don't know their language. We don't know how to talk. So Asha is among them only. Asha is the lady from the village only. Hannah, she know how to counsel her people, her village people, I mean. So she will counsel this lady that we will do an institutional delivery only. Why? So she will attract the mother, attract the pregnant lady, that you will get money, the cash money, if you do the institutional delivery. So the government is offering money to the mother also, to Asha also, as a package we are giving. So let's see Janani Suraksha Yojana. In the rural area, it's more required. In urban area, it's not very much required, because in urban area, people are already aware. Hardly any home deliveries takes place. Maximum deliveries are automatically institutional. So rural area, urban area. Okay. In each of them, there are two types of states: low performing state, high performing state. So out of total states in India, how many states are there in India? Government has divided the states into two parts. Some states are low performing, some are high performing. Kerala is there, Punjab is there. In low performing, maybe Uttar Pradesh, Madhya Pradesh, maybe, based on their IMR and maternal mortality rate. The states in which maternal mortality is high, they are low performing. The states in which maternal mortality is very low, hardly negligible, they are high performing state. So based on that we have. So main it is required in low performing states. In high performing states, it's not required. Got it? Not very much required. Got it? Say yes. Say. So see, government is giving a total package of 2,000 and 1,300 in the rural areas. For low performing states, it's 2,000 package. And for high performing states, it's 1,300 package. Out of this package, 600 is given to the Asha. Asha's cut is fixed, that I will take 600 per delivery. है ना, 600 per delivery. This is Asha's cut. The remaining will be given to the mother for doing institutional delivery. So out of 2,600 minus हो गया तो कितना बचा? 1,400. And out of 1,300, 600 minus हो गया तो 700. So please learn. So government is giving a total package of 2,000 and 1,300. Out of 2,600 given to the Asha and 1,400 given to the mother. For what? For mother is given what do you say, the money for doing institutional delivery, and Asha is given the money for taking the mother to institutional delivery. She is supporting her, no? She is convincing her. So this is incentive based. Got it? So your mother's package is given to mother's account only. It is not the husband's account. She should have her own account in the bank. It will be given in the bank, not cash. And Asha is given to Asha. Got it? This is how we do. Say yes. Asha को भी 600 पूरे नहीं मिलेंगे. 600 में से भी divided into two parts, 300, 300. 300 for the antenatal component and 300 for institutional delivery. Throughout the 9 months, Asha should do the antenatal component. She should give the 2 doses of tetanus vaccine. She should give the iron. She should do the deworming. She should do everything. Then 300 is given. And then institutional delivery, again 300 is given. So total 600. This is how government is attracting for institutional delivery. This is for rural area. Come on urban area. In the urban area, see the total package. Here the total package is 1,400 and 1,000 only. Because in urban, it's not required. That's why package is very low. People are already aware. Again, but in urban, 1,400 and 1,000, the Asha's package is 400. It's fixed. So 1,400 minus 400, it's 1,000. And 1,000 minus 400, it's 600. Say, people say. So 400 में से भी 200 Asha को, antenatal, postnatal. How many of you got it? Janani Suraksha Yojana. You get many questions out of that. Janani Suraksha Yojana. Hannah, so tell me how to draw it. How to draw it? So say, ma'am, rural. Okay, rural and urban. The first thing. ठीक है, rural and urban. Here also low performing state, high performing state. And here also we have low performing state, high performing state. We make a 2 by 2 table. So divide them in 3, 3, 3 column now. Listen, the mother package, the Asha package. यहाँ कहाँ लिख दिया मैंने? Yes. So I want to say mother package, Asha package, and total package. Here also mother package, Asha package, and total package. How I learn? I learn total. I learn total. I don't learn mother and Asha. I learn total. So I learn like 2,000. I learn like 1,300. I learn like 1,400, and I learn like 1,000. That's it. And I know Asha's cut is fixed. In rural area, it's 600. And in urban area, it's 400. Whatever is the pending is given to the mother. So mother will get here, I guess, 1,400. Here the mother will get 700. Here the mother will get 600. And here, no, not 600. It's 800. Shares of that, no, that's 1,000. And here the mother will get 600. Whatever is getting the mother. That's it. This is how we learn. People respond here. Come on, got it. This is Janani Suraksha Yojana. I tried hard to explain you. This is Janani Suraksha Yojana. अच्छे अच्छों को समझ में नहीं आता. Okay, this is Janani Suraksha Yojana. Learn that. The next is the Vande Mataram scheme. What is Vande Mataram scheme? In Vande Mataram scheme, it is launched for providing safe motherhood service. Now, do you have a nursing home? Are you a lady doctor? Do you have a maternity home? Are you a OBG specialist? Or you are a simply MBBS doctor? Hana, it is a voluntary scheme. You can opt for Vande Mataram to the government. There is a website you can apply it that I want to participate in Vande Mataram scheme or I want to enroll that. So the government will provide free of cost iron folic acid tablets, OCPs, and TT injections. It will provide it at your clinic free of cost because you have enrolled here. So all the females coming to you, you should also provide them free of cost. You are just a mediator taking from the government and providing it to their patients, not patients, the pregnant ladies. Hana? So that is via multiple persons who are enrolling in Vande Mataram scheme. The government is distributing the iron folic acid tablets, OCPs, and TT injections to the pregnant ladies. We want all the pregnant ladies should get all three. Hana? OCP is not required during pregnancy. I mean, OCP is required for the reproductive age group. IFA is required for adolescence also, IFA is required for pregnancy also, and TT is given during pregnancy. So these are the things given to you. Okay, so this is a voluntary scheme. Anyone can participate. If you wish, you can also participate. The next is Pradhan Mantri Matra Vandana Yojana. Pradhan Mantri Matra Vandana Yojana. You can see there is a mother and there is a kid. Hana, this is the logo. Pradhan Mantri Matra Vandana Yojana, also known as maternity benefit scheme, also known as pregnancy aid Yojana. Hana. So here a cash benefit, not an account, directly cash. A cash benefit of 5,000 is given for the first delivery. For the first delivery, but that too in 3 installments, directly nahi. This is by Women and Child Development Ministry, it is given. Okay, so the first installment when the pregnancy is registered. The first pregnancy, there is a lady who becomes pregnant first time. So she has to come to the sub center and get it registered. She will get 1,000 rupees for that. Hana, at least one antenatal checkup. Minimum 3 are required, but at least one antenatal checkup she is doing after 6 months of the pregnancy during the 3rd trimester. So she will get additional 2,000. And after the childbirth is also registered and child has received BCG, OPV, DPT and hepatitis B. The 4 vaccines are given to the child. She will get additional 2,000. So see how government is giving more and more cash benefits and incentives to the mothers so that all these targets are fulfilled. Hana? So this is known as Pradhan Mantri Matra Vandana Yojana, in which the government is giving a cash benefit of 5,000 on the first delivery to the ladies who live in rural area or any ladies. है ना? Number 1, it is in 3 installment. एक साथ नहीं 5,000 मिलेंगे. Only in first delivery. It is not the ladies becoming pregnant again and again to take the 5,000. है ना? It's only for first delivery. The delivery should be registered. Number 1. Number 2, during the 3rd trimester, there should be 1 antenatal visit. And number 3, the childbirth should be registered. And child should get the basic vaccination. So that is 2,000 again. How many of you got it? This is the Pradhan Mantri Matra Vandana Yojana, PMMVY. Okay. The next is Janani Sishu Suraksha Karikram. This is not Janani Suraksha Yojana. Hana, along with the Janani, we are taking care of Shishu also. Who is Shishu? The newborn. The newborn is Shishu. The Janani is the pregnant lady. So we want to take care of pregnant lady. Not only this, we want to take care of the neonates also. The pregnant ladies as well as neonates. दोनों को हमें देना है ना? So beneficiary, the pregnant ladies. Who are the beneficiary? Okay, all the pregnant ladies are there, है ना? Along with during delivery. Just a second. All the pregnant ladies, all the deliveries who are in labor, who are delivering, है ना? They are also beneficiary. Post delivery till 42 days. The ladies can claim this Karikram, and the infants up to 1 year of age. These are the beneficiaries. Hana? The punchline is that it should be 0 out of pocket expenditure. 0 out of pocket. There will be 0 expenditure in the entire pregnancy. Hana? So all the care will be given by the government. Hana? Rather, at the time of the labor pain, the free pickup and drop will be provided by the government only. So ambulance will come, free pickup will be there, and after the delivery, free drop will be there, institutional delivery. All the medicines, all the diagnostic thing, all the things of the newborn, everything will be free of cost. It is known as 0 out of pocket expenditure. So that is Janani Sishu Suraksha Karikram. Hana? This is the logo. You can see Janani and Sishu. So we can go ahead. Hana? So that is the thing. The next is Suman. What is Suman? So read these full forms here. It's very tedious. है ना? Surakshit Matritva Ashvasan. Surakshit Matratva. Matratva. Okay. M is Matratva and AN is Ashwasan. Surakshit Matratva Ashwasan. है ना? How many of you don't know Hindi? Anyone who don't know Hindi? So it's out of your scope. Even who knows Hindi, it's difficult for them also to learn. So such a pure Hindi. How many of you don't know Hindi? Huh? It is Suman. है ना? So Surakshit Matratva Ashwasan. So what is the aim? The aim is assured, dignified, respectful, quality health care at no cost. At zero cost, we should provide a assured care, a dignified care, a respectful care, and a quality health care to all the pregnant ladies with zero tolerance of denial of the service. If anyone who is not doing the service normally, any nurse, any doctor, there is zero tolerance for that. Hana? And of all preventable maternal and newborn death, we do not want in the country, none of the mothers should die. No, during pregnancy, if any mother is dying now, it's a very bad thing. Means the healthcare service of your country is the worst. Mother should not die. Hana, during pregnancy, at the time of the delivery and within 42 days. No. And there should be no newborn death. There should be no. So we want that. We want to end all preventable cause and provide a positive birth giving experience, positive birthing experience to the mother. We want to provide that. This is Suman. This is Suman. Hana? So you have to just learn all the pregnant ladies, all the mothers up to 6 months post-delivery, and all the sick newborns are the beneficiary. The next is Pradhan Mantri Surakshit Matritva Yojana. Pradhan Mantri Surakshit Matritva Yojana. You can see. So 9th of every month. I mean 9th January, 9th February, 9th March, 9th April, 9th May, 9th June, July, August, September, October, November, December. 9th of every month. No tarikh is fixed in 14 states, not the entire country. Free health care will be given to all pregnant ladies, even in private hospitals, not only in government. Hai? So the poor lady who is pregnant coming to a private practitioner also on the 9th of every month, the private practitioner cannot deny and cannot take the fees. Hai? So she's coming on the 9th of the month, and that is the under the program. So 9th June ko ye launch hua tha. So free treatment is given to her, to the poor pregnant lady. You got it? So Pradhan Mantri Surakshit Matritva Yojana. So if you are a gynecologist, OBG, and you are practicing private, not in a government hospital, you take fees, of course, from your patients, not patients, the pregnant ladies. So you take the fees. But any lady who is coming on the 9th of a month and she's having this card, she's enrolled under this, and she want to claim it, you cannot deny. And free of cost, you have to give the treatment. Hannah? So this is the thing. Okay. So that is the thing. Let's go ahead. The next is INIP. What is INIP? Intensified National Iron Plus Initiative. I repeat, Intensified National Iron Plus Initiative, INIP, Iron Plus Initiative. It comes under Poshan Abhiyan. It comes under Poshan Abhiyan. What is Poshan? Acha? Poshan is not this Poshan. There is a full form of Poshan. Pradhan Mantri, P is for Pradhan Mantri. Outreaching scheme for holistic nutrition. Holistic nutrition, that is Poshan Abhiyan. So under Poshan Abhiyan, it is INIP. Don't try to mug it up. You will become mad. It will be there in the options. You just have to pick the option. Anna, it is 6 into 6 into 6 strategy. I have already taught you what is 5 into 5 strategy. I have already taught you what is 5 into 5 strategy. It was RMNCH. It was 5 into 5. The 5 beneficiaries, you know. Hana? So HA. This was the strategy. And 6 into 6 into 6 is INIP. So there are 6 beneficiaries. To these 6 beneficiaries, I will tell you who 6 beneficiary. We will give 6 intervention. And to these 6 beneficiary, we will give 6 institutional mechanism also. That is 6 into 6 into 6. Who are 6 beneficiary? What is the vision? Why we are giving intensified iron plus initiative? Why we are giving iron free of cost to them? We want a anemia mukt Bharat. So the vision of this program is anemia mukt Bharat. We want an India, there should be no anemia in that India. So anemia mukt Bharat is the vision. The punchline given to this program. INIP ka vision kya hai? Anemia mukt Bharat. What is the objective? Objective is reduction of the anemia prevalence by 18% in all the target groups by 2022. 2020 is already passed. ये बहुत पहले launch हुआ था, है ना? The 6 beneficiaries are 6 month to 60. Make it 60. 59 मतलब 60 होता है. 6 to 60 month. So 6 महीने से लेके 5 साल का बच्चा. 60 month यानी 5 साल ही होता है ना? So 6 to 60 month, all the male and female. बच्चों में anemia is very common, है ना? Because child do not eat much, है ना? So my kid is also not eating, है ना? So that is 6 months to 60 months. So anemia is very common in children. So if the child is anemic, iron supplement should be given thoroughly. Okay. Then 5 years to 9 years. Okay. Both males and females. 5 to 9 years also the second beneficiary. So 6 months to 5 year. 5 year to 9 year, here both male female, here both male female. 10 to 19 year, Adolescent, again both male female. So 6 month to 5 year, 5 to 9, 10 to 19, male female, male female, male female, है ना? After 19 take only females, 20 to 45. Take only females of reproductive age group who are non-pregnant and non-lactating. The reproductive age group females, 20 to 45. Don't take males in this group, है ना? After that, take pregnant. Of course, pregnancy only in females, not males, and take all lactating. So males are till 19 only. उसके बाद के males को नहीं ले रहे हैं. Got it? Say yes. So these are the 6 beneficiaries. Can you enumerate what are the 6 beneficiary? Say, ma'am, 6 month to 5 year. Say 5 year to 10 year. Say 10 year to 19 year. है ना? 19 or 20, whatever. 20 to 45, pregnancy, lactation. So here male and female both. Here also, here also. But here only female, only female, only female. Obviously, lactation and pregnancy to सिर्फ female में ही होगा ना? But this is also only female. Got it? Say yes. So these are the 6 beneficiaries. So what करेंगे क्या इन सब का? इन 6 का क्या करना है? We will give 6 intervention. What 6 intervention? To these 6 beneficiaries, we are going to give 6 intervention. We want an anemia mukt Bharat, है ना? So what 6 interventions we are going? We are going prophylactic iron folic acid tablets free of cost. Have you seen? Yesterday I have shown you the strip. So it is prophylactic iron folic acid tablets. These are the iron folic acid tablets, the red and the blue one. We will provide them free of cost. We will do the deworming. What do you mean by deworming? There are certain parasites. Have you heard the name of some parasites? These are known as hookworms. Hookworms, Ankylostomum duodenale and Necator americans. They drink blood in the intestine, and because of which the anemia is there. So you are keep on giving iron, but patient is still anemic still. So you have to do deworming also. And especially in children, the worms are very common. They drink blood, and that's why the child is anemia. Treatment of the anemia. This is prophylaxis. If the person is already anemic, treated. है ना? Behavioral change communication. Behavior change communication. Always motivate them to eat the green leafy vegetables. Motivate them the things which have iron. Motivate them to eat the jaggery. You change the behavior by doing communication. है ना? Talk with them throughout the year. है ना? Mandatory provision of fortified foods. है ना? IFA fortified foods you have to give. है ना? Iron folic acid fortification is done. Like salt, iodized salt fortification, iodine fortification is done in the salt. वैसा. And non-nutritional causes of anemia is there, you have to take it out. है ना? Like malaria, fluorosis, or sickle cell anemia. These are the non-nutritional causes of anemia. So rule out that also. Address that also and treat it. So these are the 6 interventions. To these 6 beneficiaries, we are giving these 6 interventions. And there are 6 institutional mechanisms also. Don't learn, just have a look. है ना? Don't learn, just have a look. These are 6 institutional mechanisms. Nobody is going to ask. So it's a 6 into 6 into 6 matrix. Maximum they can ask a question this. 6 into 6 into 6 is what? INIPI. INIPI का vision क्या है? Anemia Mukt Bharat. What do you mean by 6 into 6 into 6? There are 6 beneficiaries, 6 intervention, 6 institutional mechanism, 6 into 6 into 6 strategy. How many of you got it? Can we go ahead? है ना? So iron folic acid tablets we give. है ना? For children, it's different. For adults, it's different. You can see. है ना? For adults, it's red color. For children, it's blue color. Okay. And for small, up to 5 years, the syrup is available. The syrup is there, not the tablet. Okay. Just that. Can we go ahead? Huh? There is a weekly iron plus initiative, WIFS. Weekly iron plus initiative is also there, in which every Monday, to all adolescents, boys and girls, the Anganwadi, free iron capsule or tablet will be given. That is weekly. है ना? So that is the thing. Okay. So INIPI में anemia management protocol you can leave. I have told you the adolescent group. Now adolescent group में you go to the school. In the school there should be a annual checkup who all are anemic. The one, it is under Rashtriya Bal Suraksha team. The Rashtriya Bal Suraksha team visit the government school once a year, and they will check the hemoglobin of all the children, the adolescent boys and girls there. So whosoever is anemic, whose hemoglobin is between 8 to 12, that is anemia. One tablet is given for 3 months. है ना? Under school teacher supervision. You can see she is the school teacher. She is giving the tablet one by one, and he is the recorder. He's just ticking that we are giving the tablet to all. These all are anemic. है ना? These all have hemoglobin 8 to 12. So these all are anemic. So they will be given free tablet for 3 months, once a day, given under supervision, and it is under the supervision of the school teacher. है ना? And after 3 months, we will do the follow-up. The first follow-up is after 45 days, and second follow-up after 19 days. If no improvement in 3 months, है ना? Then we will refer it. Maybe some other causes there. So this is adolescence, how we do under Rashtriya Bal Suraksha Karikram. Got it? In pregnancy, where we do? In pregnancy, we do it at ANC clinic. At ANC clinic, we know that we give them free iron folic acid tablets. Can I proceed? The next is Lakshya. What is Lakshya? What is Lakshya? Say the full form. Labor room. L is labor room. Labor room. L is labor. Labor room. Quality improvement. Quality improvement initiative. है ना? Labor room quality improvement initiative is SHAYA don't have any full form. So Lakshya is labor room quality. It is related to labor room quality. So improved quality of the labor room should be there. है ना? Improved quality of care provided to the pregnant lady in the labor room and maternity operation theaters. Okay. So that is the thing. So that we can reduce the preventable maternal and newborn mortality. So these all initiatives are taken by the government. This is Lakshya. Okay. Labor room quality improvement initiative. Just learn the full form, learn the logo. Learn the logo, it's like a hit, it's a target. And this is Lakshya. You can get image-based question on that. Say yes, say something, respond. So these are the national programs. You just take one line in them. Sabka goal, target, objective, don't learn that. Nobody is going to ask you that. At your level, this much is sufficient. You should know the name of the programs, what all are working. You should know their logos and main points in that. That's it. Okay. Navjat Shishu Suraksha Karikram. Navjat Shishu Suraksha. Now it's not maternity. It's the newborn. It's a newborn. So train the doctors and train the Anganwadi workers for basic and resuscitative newborn care and urgent referral. Hana? So if you are a A&M worker or if you are a doctor, you should be trained. So training is given in this. Hana? So we provide home-based post-neonatal care. It was launched in 2011. Asha will give how many visits? 1 prenatal visit at the 8th month of the gestation. Hana? 1 prenatal. 6 postnatal visits. 6 postnatal after delivery. Hana? If home delivery is taking place. Hana? We are trying to give Janani Suraksha Yojana. But still after that, many mothers say, no, I do not want any money. I will do home delivery only. I will not do institutional delivery. Okay, you do home delivery. Asha tried to convince her, but she is not convincing. She is saying, I will do only home delivery. I will not go to hospital. Hana, in my own environment, I will do the delivery. So, okay, do the home delivery. So, after home delivery, Asha will do 6 visits. How many visits? 6 postnatal visits to the home of that lady. On day 3, on day 7, on day 14, day 21, day 28, and last visit on 42. Hana? So, this is the total 6 visits. 7 visits. I'm sorry. No. 6 visits in case of institutional delivery. Because institutional delivery, the delivery is done in the hospital. So on 2nd day, the lady is discharged, or maximum 3rd day. So she is discharged on 2nd day only. So the next day, the Asha is going to the home. And in case of home delivery, 7 visits Asha is doing. 1 visit extra on the day of the delivery. And in LSCS, only 5 visits are required. Day 1 and day 3 are skipped because LSCS cannot take place at home. It will take place in hospital only. Okay. So this is home-based post-neonatal care. Home-based. Can you see? There is a home. You can see there is a home. You can see there is a mother. You can see there is a jhula. In which there is a kid. So home-based care we are giving. The mother and king, they are not coming to the institute. The Asha is visiting 6 times or 7 times and giving the care there. Okay, so that's all about the mother programs. Can we start the pediatric programs now? Can we start the pediatric programs? The pediatric programs, maybe half an hour more. We will finish. Are you people there? Okay. So let's continue with the pediatric programs. Let's finish it off without any break. Maybe half an hour or 40 minutes, we will just pack the PSM. Okay, if we take the break, unnecessarily it will be stretched. So pediatric programs. In the pediatric programs, the first is the neonatal care under RMNCHA. So I'm talking about this neonatal care. So how many types of neonatal ICUs are there? So, in the labor room, whenever the delivery takes place, as soon as the newborn come out of the mother, either the vaginal delivery or the cesarean section, in all labor room, there is a corner. It is known as newborn care corner. So as soon as the newborn come out, pediatrician take care of the newborn. The gynecologist, so there are 2 people in the labor room. One is obstetrician, and one is pediatrician. So obstetrician take care of the pregnant lady, the mother, at the time of the delivery. As soon as newborn come out, obstetrician don't look for the newborn. The pediatrician will take care of that. So there is a separate corner in the labor room itself. So they take the newborn in that corner. It is known as NBCC, newborn care corner. At the point of the delivery only it should be there. So newborn care corner is there. Okay, newborn care corner is there. So healthy, if the newborn is healthy, just after that, Apgar score is done. And basic, we will see everything is okay. There is no congenital disorder grossly visible. Apgar is normal. We hand over to the relatives. we hand over the newborn to the relatives, we are done, है ना? And we shift the mother to the ward or recovery room or whatever. Okay, and after within half an hour, we try to start the breastfeeding. We try to do the room in. That is same room in mother and baby should be there, and we hand it over to the relatives if the newborn is healthy, if the healthy newborn is there. Okay, but if the newborn is sick, what we will do? So after NBCC, we will take it to NBSU. That is newborn stabilization unit. है ना? It's there in the hospital, newborn stabilization unit. We will try to stabilize it. We will try to stabilize. Sometimes the newborn is not crying, है ना? So we will try to stabilize. We will try to give some ventilation or something. We will try to make it cry. Crying means breathing. If the newborn is not crying, not breathing. Because inside the uterus of the mother, newborn was not breathing. The fetus was not breathing. The fetus was getting the oxygen from the placenta itself. As soon as it comes out, the placenta is cut. And now the oxygen is not provided by the placenta. So newborn has to breathe of its own. So first time the air will go inside the birth, inside the lungs. So first cry of the baby is the first breath of the baby actually. So baby not crying at birth means they are not breathing. So ventilator or some support is required. So that will be given in newborn stabilization unit, NBSU. NBSU. But some here NBSU basic care we will give. But some newborn are very sick. They are very sick and they require ventilator or some major surgery to save them. So they are shifted to SNCU, sick newborn care unit. Sick newborn care unit. Okay, they are shifted there. So in the labor room, it is NBCC. After that, then if the newborn is healthy, they are handed over to the relative. If not healthy, they are shifted to NBSU. If not very sick, they are shifted to SNCU. You should know their full forms. Newborn care corner, newborn stabilization unit, sick newborn care unit. Say yes. And if they are not taken care there also, they are referred and they are further referred to the district hospital. Okay, if we require, we will refer them. So this is the complete care we provide. Say yes. Say yes. So all the newborn are in NBCC, but the sick newborn in NBSU and extremely sick newborn is SNCU. I told you the full forms. Here only one graduate doctor, MBBS doctor will also work and one nurse is there. Here one pediatrician is required. Here one MBBS doctor can also assess the obstetrician. Here NBSU at least one pediatrician should be there. And here along with one pediatrician, 2 to 3 MBBS doctors along with 14 to 16 nurses are there. This is 0 bedded, this is 4 bedded, this is 20 bedded hospital. So this is the newborn care. The next we are studying is Rashtriya Bal Suraksha Karikram, RBSK. Rashtriya Bal Suraksha Karikram. The next one. So what does this say? Now this is not regarding the newborn. This is regarding the children. This is the logo. You can see. Oh, I'm sorry. This is the logo of National Health Mission. So Rashtriya Bal Suraksha Karikram, I'm telling you now. There has to be screening of 32 diseases. There has to be screening of 32 diseases. Screening of 32 diseases in the children. This was launched in 2020. The screening has to be done in 0 to 18 years of age. This is known as BAL group. BAL yani bacche, 18 up to 18 years. And if any disease is found, free treatment is given. So what are the 32 diseases? Can you say? We divide the 32 diseases into 4 groups. DD. Defect at birth, the diseases due to deficiency, the diseases of childhood, and diseases due to development. So let me tell you, out of 32, you can see these are the 32. 9 of them are defects at birth. Screen it. Does the newborn have neural tube defect, Down syndrome, cleft lip, talipes, dysplasia, congenital cataract, congenital deafness, congenital heart disease, retinopathy? Don't learn. These are the defects at birth. These are the deficiency, not present at birth, but later on. Due to iron, there can be anemia. Due to vitamin A deficiency, there can be Bitot spot. Due to vitamin D deficiency, there can be rickets. Due to protein deficiency, that is malnutrition. Due to thyroid deficiency, there is goiter. So these are developed later on. And these are the diseases of the childhood. Like skin diseases are very common. Scabies is common in children. Otitis media, rheumatic heart disease I taught you. Airway diseases, dental caries are common. Convulsions are common in children. And these are the developmental delays. Vision impairment, hearing impairment, neuromotor, motor delay, cognitive delay, language delay, behavioral disorder, autism, learning disorder, and attention deficit hyperactive disorder. Okay, so all the 32 diseases should be screened and freely treated. It is Rashtriya Bal Suraksha Karikram, RBSK. Screening is done at multiple level. Screening is done in the school. In the school. These are the 32 diseases in front of you. Say yes. Got it? So where the screening is done? 0 to 6 week, it is done house to house. It is done by Asha. 6 to 6 years, it is done by Anganwadi worker. and 6 to 18 years it is done in the school. So screening is done. Screening is done and free treatment is provided to them. Okay, we are done with the programs for the pregnant ladies, mothers. We are done with the programs for neonates. We are done with the programs for children. I told you many programs. Here the main program is Rashtriya Bal Suraksha Karyakram. For neonates, I told you home-based neonatal care. And for pregnant ladies, I told you many programs, Pradhan Mantri wali. And now I'm coming on adolescent group. Adolescent. I'm teaching you this now. RMNCHA. So lastly, adolescence. We have already seen maternity. We have already seen neonate. We have already seen children. Now, reproductive, I have told you there only in family planning yesterday. So I'm coming on adolescence lastly. So this will be completed. So I'm coming on adolescent programs. Can I come on the adolescent programs now? In the adolescent programs, the main program here is the Rashtriya Kishore. Who is Kishore? Kishore is a young like adolescent person is known as Kishore. Swasthya Karyakram. Rashtriya Bal nahi. Initially, I taught you Rashtriya Bal Suraksha Karyakram, and now I'm saying Rashtriya Kishore Suraksha Karyakram. Rashtriya Kishore Suraksha Karyakram launched in 2014. It is for adolescents, both boys and girls, 10 to 19 years of age we cover. So this is the logo. You can see they are playing with a kite. You can imagine the age. So it's 10 to 19. You can learn the logos of all. Okay, there are 6 priorities here. We should take priority of their nutrition. Number 1, in this age group, we are talking of age group of 10 to 19 years. You should take priority of their sexual and reproductive health. Mental health, very main. This is the very delicate age. Mental health. Substance misuse. This is the most common age when they can misguide by someone and they can do the misuse. Like looking at the television, someone is smoking, they can start smoking. They can start gutka chewing. They can start drinking alcohol like that. Injuries are very common in this because they play games, outdoor games. Injuries are common, and violence. Sometimes violence and non-communicable diseases are common. So 6 priorities are given. These are the 6 priorities for this age group. Rashtriya Kishore Suraksha Yojana. Understand, don't learn. School health program also come here because in the school maximum crowd is adolescent age. Most common, I told you yesterday, dental caries are most common in the school population. Medical examination done every 6 months. Eye checkup is done by the school teacher. We train the school teacher how to do it. Every 150 student, one school teacher. And it is done from class 5th to 8th. 5th to 8th class के बच्चों का करेंगे visual checkup in the school free of cost every 6 months. And 10 to 14 years of age group. 5th to 8th यानी 10 to 14 years ही होता है. In 10 to 14 years, the child is in 5th to 8th class. And we will ask the teacher if any of the child is less than 6/9 vision, refer it to the PHC. The child will come with to the PHC. We will examine, confirm, and give free spectacle. We will give free of cost glasses and spectacle to the child, free of cost. No, nothing, no charges will be taken. So the teacher will refer it to the PHC. Anyone who is having visual acuity 6/9. So learn what is red, just learn that. Got it? Now 3 programs I'm going to teach you which sound similar. Ujala, Ujwala, Ujawla. Little bit difference. This is Ujala. This is Ujala. What is Ujala? Light. Ujala is what? Light, if you know Hindi. So this is a program in which affordable LEDs are provided to the village people. Affordable LEDs. The LEDs are at very affordable price. So that is Unnat Jyoti. This program is run by Unnat Jyoti. Affordable LEDs. It comes under domestic efficient light program. Domestic efficient lighting program. So this is domestic efficient lighting program, Ujala program. You can see an LED is dancing here. So this is Ujala. The second is Ujawla. Ujwala, I'm sorry, not Ujawla. Ujwala. 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 Who is Ujwala? Ujwala is a lady who is cooking on LPG gas. We want all the ladies in India, don't cook on the coal. Don't cook on the wood. Don't burn the wood and cook on that. Don't cook on the coal. We will provide free LPG gas. So the government is giving subsidy and free LPG gas to all the poor ladies. So the name of the lady is Ujwala. She is Ujwala. She will cook on the LPG. All the ladies who are below poverty line, we will give them free LPG gas. And the next is Ujawla. Ujawla is prevention of childhood sexual trafficking. Nowadays there are many groups, especially the girl childs, they take it to some other countries, and for sexual trafficking gangs are there. So prevention of that. So rescue them, rehabilitate them, reintegrate them. है ना. Recently many gangs are found that they are doing so, है ना. They take the adolescent girls or small girls, or not only girls, the boys also, and sexual trafficking group is there. So that is Ujala, है ना. So that is the 3. So please learn the 3 programs: Ujala, Ujjwala, and Ujjwala. You usually get question on them because they sound similar, no? Say yes, people, say yes, है ना. Say yes. The next is free days, menstrual hygiene program. So in the females, है ना, in the adolescent females, menstruation every 28 days, है ना. So name of this program is free days, है ना. So free sanitary napkins are provided free of cost, है ना, by the Asha to the to this adolescent girls, है ना. But initially it was free. Now it is chargeable at a very nominal price, that is ₹1 per pad. So 2 types of pads are available. Free days, this is free days. Anna, these are the sanitary napkins. These are free of cost. But the second one, Suvidha. This one is Suvidha, you can see. Anna, this one. It is ₹1 per pad, and these are biodegradable sanitary napkins. These are ₹1 per pad. So that is the free days. We are done with that. Now, infectious disease program, really not very important. The TB and malaria is there. You can read off your own. TB mainly you will read. RNTCP guidelines, I will tell you. Learn the logo of the TB first. You can see TB Mukt Bharat. You can see a person dancing, red color person dancing like TB Mukt Bharat. So this is the logo, है ना. TB हारेगा देश जीतेगा. This is the punchline we gave. TB हारेगा देश जीतेगा. National Tuberculosis Elimination Program. National Tuberculosis Elimination Program का logo है ये. You can read. See, है ना. Got it? Okay. Yes, all the programs are working in all the states, Mahima. Many programs are working in few limited states, but in PHC, wherever there is a PHC, all these programs are applicable. Hana, so PHC. So basically, the programs are in the rural areas. Hana, in the PHCs they are working. In the government hospitals they are working. In all government hospitals. So let's go ahead. National Tuberculosis Elimination Program. This is the logo of the TB. You can see, Hana. So don't learn all these things. Okay. Don't learn the numbers and figures. Control of TB. From here you can come. Okay. Sputum collection. Sputum collection under National TB Elimination Program. Imagine any patient who is having cough for more than 2 weeks, and the person is taking the antibiotic but unable to treat it till now. Okay, just a second. Cough since more than 2 weeks. Hana, fever, especially in the evening. Hana, hemoptysis means cough contain the blood. When coughing, the sputum is containing the blood. Unexplained weight loss and reduced appetite. Whenever any person presents, so it is the indicator you should do the sputum collection for TB. Maybe the person is having TB. Learn the 5 indications. Okay. How many sputum collections you will do? Hana, we will do 2 sputum collection. First, on spot. On spot. The patient is coming to you. On spot, give a sterile container. Provide a sterile container, ask the patient to cough, and provide a sputum in a sterile container and submit it to the laboratory. That is on spot, label it as E. Hana, second container, empty container you provided for home. Take it to home, and early morning, the next morning, the first sample you will give and submit it to the laboratory. That is label it as B. Hana, and labeling is done on the container. Say patient ka naam, Hana, patient ka whatever is naam, XYZ. Write it here. Don't write the name. Initially we used to write it sometime on the lid. Lid यानी ढक्कन. तो ढक्कन तो exchange हो गया. I'm having 10 samples with me, so I am a technician. I have opened all 10 samples. सबके lid open किए और मैंने उल्टे सीधे लगा दिए. Report उल्टा सीधा चला जाएगा. So labeling is never done on lid. It's a rule in the lab, है ना? On the microbiology, pathology lab, never do the labeling on the lid. Lid can be interchanged ना after opening. Once open, you are not sure कि कहाँ से open किया. ये सब open कर दिए मैंने, 2 एक साथ open कर दिए. मैं भूल गई कौन सा ढक्कन किसका है. उल्टा लगा दिया तो भाई एक positive था एक negative था. Movies में देखा ना? So उल्टा सुल्टा report नहीं चाहिए. So we will do the labeling on the container, not on the lid. So take 2 samples. Now, if any of them, this is sample A on spot, this is sample B, the next day early morning sample. If any of them, this is positive, this is negative, or this is positive, this is negative, or both of them are positive, I will consider the patient as TB. Hana, if any of them is positive. If both of them is negative, then it will be negative. I will consider it as negative. Hana, and we will ask for this PCR. We can ask for PCR, which is more specific. Can we go ahead? So this is how sample collection is done. And who is a case? Who's a case? Who's a new case? A patient of TB who has never taken the treatment of TB in the past, who has never taken the DOTS treatment in the past. That is considered as a new case. Who is a previously treated case? Who has received at least 1 month of treatment in the past and left in between. That is known as previously treated. Hana? So resistance बाद में देखते हैं. Let me teach you the treatment first. Just a second. The new treatment guidelines. So the new treatment guidelines, there are two phases. Have you heard about the two phases? Intensive phase and continuation phase. What is intensive phase? In intensive phase, we give the treatment to the patient in front of us. I mean, it is supervised. It is always supervised. है ना? And continuation phase, only the first dose is supervised. है ना? For example, we divide the patient into two categories. है ना? Intensive phase, continuation phase. Okay. We divide the patient. This is a new case. This is a new case of TB. Okay. This is a new case of TB. So for the first 2 months, patient has to come daily to the hospital. In front of me, I will give a tablet and patient has to take the tablet in front of my eyes. Not only the doctor, any healthcare provider can be the supervisor. In case the child is going school and cannot come to the hospital daily, school teacher can be the supervisor. In front of the school teacher, that has to. So in front of someone, it should be confirmed that the patient has taken the treatment, the tablet that day. So you know how many anti-tubercular drugs are there? There are 5 anti-tubercular drugs. HRZES. Is pharma class done? You know what is HRZES? I guess everyone knows H is isoniazid, R is rifampicin, Z is pyrazinamide, E is ethambutol, and S is streptomycin. These are the 5 anti-TB drugs which are provided to treat the TB. So out of them, which 4 are given? Here 4 are given, HRZE. S we don't give. S is injectable. We don't give S here. So in intensive phase, we give only 4. Combining we make 1 tablet, a big tablet. And patient has to take 7 days a week. Daily patient has to come for the 2 months, and we will give one tablet containing 4 things inside that. We don't give 4 different tablets. We give 1 tablet combining all 4. Say yes. Got it? And in continuation phase, the next 4 months are the continuation phase. After that, patient has to come every Monday. In every Monday, the first dose patient will take in front of me. The remaining doses the remaining 5 doses or 6 doses, I will give it for home. The remaining 6 doses. Out of the 7, I will give the remaining 6 doses for the home only. And the next Monday, patient has to come with an empty strip. So that I will be assured that you have taken all the doses at home. Then only I will refill. For the next week. Every week patient has to come. The first dose is supervised. Here I will give only 3 things. HER. I will not give Z. So here 3 things combined and I will make a smaller tablet. And we will give them. Say yes. Got it? This is the new guidelines of the TB treatment. Say, people say. So this is how you can see. So this is the tablet containing 4 things. HRZE. You can see this is a relatively bigger tablet. So this has to be taken in intensive phase. The name of the tablet is 4 fixed drug combination, FDC tablet. It contains 4 drugs inside that. 1 tablet containing 4 drugs. This is known as 4 FDC. FDC is fixed drug combination tablet. And this is containing 3 drugs only. That is H, R, and E. It doesn't contain Z. So this is given in continuation phase. So first 2 months this one, and then later on 4 months this one. Say yes. Got it? This is how we provide the treatment. This is DOTS. I'm teaching you DOTS. So this is known as DOTS. Directly observed therapy, short term. So this is the treatment under DOTS. So whatever new patients are there, ask them total 6 month ka treatment hai. Total treatment is of 6 months. Out of the 6 months, the first 2 months is intensive phase, and the next 4 months is continuation phase. Here you have to come to the hospital daily. It will be all the doses are supervised. And here you have to come to the hospital once a week. Every week. We will decide a day every Monday, every Tuesday. And the first dose is supervised, rest are given for the home. This is like that. Say yes. Got it? This is like that. So here we will give you 4 tablets. 1 tablet containing 4 drugs. I will give you 1 tablet containing 4 fixed drug combination, 4 FDC. Here I will give you 1 tablet containing 3 fixed dose combination. So here I will give you HRZE. Here I will give you HRE. I have shown you the strips also. Say yes. So this is how we treat a new case. A case who has not taken the TB treatment in the past, and first time the patient is having TB. So this all you will read in pharmacology also. In pharmacology also you will you will read it. Better you will read it. Okay. That's it. I'm not going in the detail. Okay. One more thing I would like to tell you. What is this pronunciation? Nikshay Poshan Yojana. Nikshay Poshan Yojana. What is this Nikshay Poshan Yojana? It is launched by Ministry of Health and Family Welfare. Now, all the TB patients, they are deficient of protein. They are very lean, thin, they are underweight. That's why the TB occurred to them. So whenever we treat them, we want they should eat very well. A high protein diet we recommend. They should eat abundant of paneer. They should eat abundant of cheese if they are vegetarian. If they are non-vegetarian, they should eat abundant of egg. है ना? We want them. But most of the patients says we are very poor and we don't have money for the nutrition also. So what the government is doing? Government is providing every month 500 rupees in the account, financial benefit till the treatment lasts to all the TB patient. है ना? It was launched on 2018. After 2018, all the new TB patient, they are given additional 500 rupees per month. In the tribal area, 750. This is for their nutrition. So we assume कि 500 में they are taking good nutrition throughout the month and good protein diet they should take. This is known as Nikshay Poshan Yojana under the TB. Got it? But direct beneficiary के account में ही जाएगा, the person who is having the TB, उसी के account में जाएगा, and it should be Aadhaar linked account. It is centrally sponsored scheme. And all states and union territories of India are there. So anyone who is having TB can enroll for this, that I want additional 500 rupees per month for having good nutrition. If the person is very poor and cannot afford for the nutrition, government will provide 500 rupees per month. है ना? MOHFW is Ministry of Health and Family Welfare. Ministry of Health and Family Welfare. है ना? So this is the ministry who is doing the sponsor from central government. So funding is important, Simran. Everywhere funding is important. है ना? Programs तो आ जाते हैं, लेकिन पैसा कहाँ से आएगा उनको रन करने के लिए? So it is the ministries which are divided. Ultimately, that is giving the financing and funding everywhere. So that is the thing. Okay. There's one more very important program, 99 Dots program. What is 99? It's very important. Listen. So I told you now in intensive phase, what we are doing, patient has to come daily to the hospital, and in front of my eyes, patient will open. I will give the tablet to the patient. I will open the strip and I will take the strip, take the tablet out, and I will give. And in front of me, he or she should take. So there is no doubt in that. Patient has definitely stick to the treatment, and it's in record. I have watched that. I or any of my sister nurse, any of my technician working under me, I will give the responsibility to them if I'm very busy. Okay, so that is intensive phase. In continuation phase, we are monitoring only first dose every Monday. What about the others? I'm giving the rest of the strip for the home. I'm asking, come next Monday. If the strip is empty, I will give you next strip. So patient is going, and after that, he's throwing just the tablets. Maybe he's not taking, or on the last day before coming, just he's taking it out, making the strip empty and giving it to me. So how I should know कि at home he has taken the treatment properly? कोई तरीका है उसको पता करने का कि घर पे उसने अच्छे से रोजाना ट्रीटमेंट लिया है मंडे से लेके अगले मंडे तक? उसका कोई तरीका है? Yes, we are doing online monitoring. That is known as 99 Dots program. Online monitoring of the treatment. Treatment adherence is important. Treatment adherence in TB, HIV patient, both of them, this program works. है ना? So the strip contain the hidden phone number. Randomly, not all. So see, this is the blister. This is the blister of the tablet I'm providing for home. You take this blister at home. So whenever the patient, and this is the start point. It is written ki start from here only, and arrows are there. It is not ki first tablet yahan se le liya, second yahan se. No, you cannot do that. I will warn the patient that you go with these arrows only. So start from here, and you can see the arrow, then here, open like in this sequence only. You cannot open anything. So the first strip, the patient is opening, nothing is written here. The second, you can see there is a hidden mobile number. So I will ask that any of the blister tablet contain a hidden mobile number. Whenever you find a hidden mobile number, give a missed call on that number. Every number is unique, every number. So a series of missed call are numbers we track, and it's computer algorithm, it's software. We don't do that. So the computer know कि इसमें कहाँ पे algorithm में it is already there कि which of them is containing the phone number. You can see here phone is drawn, here phone is drawn, here phone is. So it is having the numbers. है ना? So we know कि on day 2 पे कॉल आना चाहिए, फिर 3 पे नहीं, 4 पे नहीं, 5 पे नहीं, फिर day 6 पे कॉल आना चाहिए, फिर 7 पे नहीं, फिर day 8 पे आना चाहिए, फिर 9. So on that day the call should come. अगर any call is missed, automatic SMS service is there. Automatic free call भी जाएगा hidden free इस पर, और a series of daily reminders भी जाएगा कि today you have missed the dose, today you have missed the dose, like that. है ना? So missed doses trigger SMS नोटिफिकेशन टू द केयर प्रोवाइडर. एसएमएस नोटिफिकेशन पेशेंट को नहीं जाएगा, उसके केयर प्रोवाइडर को भेजेंगे. अगर बच्चा है तो उसकी मदर फादर को एसएमएस नोटिफिकेशन जाएगा कि टुडेज डोज इज मिस्ड. Got my point? So this is the 99 Dots program. How many of you got it? It is an online monitoring of the adherence of the program. है ना? Through fixed missed call. है ना? A free call to the hidden phone number. है ना? A series of missed calls are there, and SMS and automated calls will come on that number if someone is missing that. So this is 99 Dots. See, government is doing how much? Many things are doing the government. People don't appreciate. Okay, so to remove, to eliminate, to decrease the incidence, to control the disease, government is doing too much. Okay, only thing, patient should adhere to the treatment. The treatment is free, the diagnosis is free. For adherence also multiple programs are there. For nutrition, additional 500 rupees are given to them. What else the government will do? So these all are the programs. You can see this is 99 dot strategy. You can see the phone numbers. This is having a phone number, this one, this one. So on that particular day only the call should come. It is not necessary कि पहले दिन यहाँ call कर दिया, दूसरे दिन यहाँ. So on day 1, on day 4, on day like that only the call should come. So we assume कि बीच के doses भी लिया है. The missed call should be there. है ना? So that's the only thing. है ना? Okay, you know 4 FDC, you know 3 FDC. This is for adult. For pediatrics, you will learn better in the pharmacology. I guess pharmacology is a better subject to teach you the doses there. Okay, so that's all about it, I guess. Don't see the detail, that's all about it. That's all. Apart from that, there are few miscellaneous programs I have enumerated. I want you to read those miscellaneous programs. Just have a look on one word of them. Don't go in the detail. Don't go. Main programs we have already covered. All the main programs I have covered. Miscellaneous program, you can see Kaya Kalp program. What is Kaya Kalp? It is Clean Hospital Initiative. This is Kaya Kalp. Can you see a tree is there? It's Clean Hospital Initiative. So every month, 2 best district hospital in the state will be announced. 2 CHCs will be announced and 1 PSC, every district will be announced. That is the cleanest one. So, you know, inspections will be there, and who is the cleanest one? That will be announced. That is the categories. And there is one more program. Just a second. Pradhan Mantri Jan Dhan Yojana, I guess everyone knows, na? Jan Dhan Yojana, do you know that? So it is interest on deposit. Accidental insurance cover up to 1 lakh and no minimum balance. So the Pradhan Mantri, respected Mr. Narendra Modi have opened, launched this Yojana that all the people in the country should have their bank account. With minimum no balance required. If 0 balance is also there, it's okay, no penalty is there. Minimum balance. The faida, what is the benefit to the person who is opening the account? Free health insurance, or not health insurance, accident insurance of 1 lakh. If accident of that person who is having the bank account, free insurance will be given up to 1 lakh, number one. And if you are doing the deposit, then interest will also be given, like every bank do the interest on deposit. And a life cover of 30,000. Yes, if the person dies, 30,000 is given to the family. On the death of the beneficiary, the 30,000. So these are the benefits of that. So that is Pradhan Mantri Jan Dhan. You can see a rupee at the center. So Pradhan Mantri Jan Dhan, and overdraft facility is there. Overdraft facility up to rupees 5,000 is available. So Pradhan Mantri Jan Dhan Yojana. Mera Aspatal, My Hospital Initiative. What is Mera Aspatal, My Hospital Initiative? It's an app. You can also open in your mobile. You can see in the Play Store also. These apps are there. So this is implementation of public and private hospitals. So patient can write his views on the quality of the experience he get in any of the hospital. So it's like review. You are visiting some hospital and patient can freely give the review on this. All the hospitals are there and they can give the review what is their experience in that hospital. Okay, so that is Mera Aspatal, My Hospital. Got it? Bedsheet color in the hospital. So there is a fixed protocol in all the government hospital. Every Monday white bedsheet should be there, every Tuesday pink, every Wednesday green, every Thursday violet, every Friday purple, every Saturday blue, every Saturday gray, every Sunday gray, because daily bedsheet has to be changed. So it compels the staff to change the bedsheet every day. So that is bedsheet. So that is for cleanliness. Okay, so that is the thing. Rashtriya Vayoshri Yojana. The free aids are provided to the old people. Old people, if they want walker, if they want the crutches to walk, so physical aid and the wheelchairs, assisted living devices will be given to senior citizen below poverty line. It is under the Ministry of Social Justice and Empowerment. Just have a look. Don't learn them. Don't learn. Free dialysis is there. E-Rakta Kosh. All the blood banks are integrated. There is an app, E-Rakta Kosh app, in which all the blood banks throughout the country, they are integrated. So if any rare blood group is required, that can be checked instantaneously that throughout the India where this blood group is available. So that is E-Rakta Kosh. And an online registration system. Nowadays, appointment can be taken online. It is not necessary physically you go and take the appointment. In government hospitals also, there is a ORS portal. So with this app, online registration, everything is digital. So online registration has to